Yeah, my name is Hoyne. I'm a consultant psychiatrist and editor of Global Psychiatry Archives. And this is an interesting paper. It's about the monitoring the adverse effects of psychotropic drugs and the need for evidence-based approach. So it's teamed by Gupta from the northeast of the UK. The interesting part is that they come up with the idea that what should be done and what should be looked at, and they give more or less three examples where different guidelines differ. So they looked at the BNF, the National Institute of Health and Clinic Care Excellence, the British Association for Psychopharmacology, and others. And what they, when they look at lithium, they come up with slightly different recommendations. So some recommend for lithium, renal, and calcium at 6 months and at least annually. And others say, okay, the Australian ones say baseline, and repeated after 6 months and annually, so slightly different. And there's others even say there should be periodically, without ever saying what it does really mean. And the same, more or less, you find the same unusual recommendations for antipsychotic. So sometimes, some recommendations to go for bloods, 4 months, 6 months, 3 months. So whatever you get on offer, that's what you can do. So then 12 weeks, World Federation of Biological Psychiatry, and 4 weeks, initially fasting, plasma glucose, and so quite a variety of things. Some focus on the lipids, some focus on prolactin, and you get the same variation with valproate. So there's not complete differences, but it can be confusing for more or less for the common psychiatrists to go with any of these recommendations if they all differ. And in this respect, they recommend, or the authors recommend, that there should be more consistency and should be more evidence-based. And probably it would be necessary that these different organizations look at each other's recommendation as well. Okay, this is the take-home message of the paper, saying, there is some need to monitor psychopharmacological medications, but it should also be clear that they should be more or less homogeneous between different organizations, and maybe these organizations should speak to each other. If you like this such type of information, please consider subscribing to our channel, and if you like this video, please just click like. Okay, thanks a lot and have a nice evening. Goodbye.